Hello, my name is Erica Cannon, and I'm going to do a head to toe assessment. Today I'm using my youngest son. So I will walk into the room with the patient and say, "Hello, my name is Erica Cannon. I'm going to be your nurse today." Um, and what I would do is provide privacy, and then I would wash my hands. And so today we have a 15-year-old male who seems to be in pretty good health. I don't see any acute distress noted right now as he's sitting here. And he is dressed appropriately for his age, just minus the shirt, which he has right here. But he's dressed appropriately. So I'm going to ask him a couple questions to check orientation. So can you tell me your date of birth?
March 16th, 2008.
All right. Do you know where you are?
Yes, I'm at home.
Okay. And can you tell me why you're here today?
Wellness checkup.
Okay. And do you know what year it is?
2023.
Okay. Awesome. So he's a learning oriented times 4. There's no sluggishness in his speech. He's able to articulate, and his speech isn't slurred. He's able to enunciate and verbalize what it is that and answer any questions that were asked. Now, so what I'm going to check now is his muscle strength. So I'm going to use my hand. I'm going to put it against his cheek, and I'm going to have him push against my hand here. So I'll start here, push against my hand. Okay, now this side, push against my hand. Okay, great. Now where's your forehead? Push against my hand. All right, your chin, push against my hand. All right, now the back of the head, push against my hand. Okay, great. Now I'm going to put some pressure on your shoulders. Now push against my hands here. Okay, great. So his muscle strength, everything, there's no abnormalities. There's a bilateral, we strong on both sides, no issues noted there. Everything is symmetrical. So now I'm gonna have you squeeze my fingers here and go ahead. All right, great. So no weakness noted. He's able to squeeze my fingers with both hands. The strength was equal bilaterally through both sides. Now I'm going to take my hand and I'm going to have you push against my hand like you're driving a car, pushing the gas pedal, push this foot. Okay, now with this foot, push. Okay, great. Now I'm going to have you lift up. Okay, great. Now lift up with this hand. Okay, both bilaterally equal, no abnormalities noted with his strength in his upper or lower extremities. Now what I'm going to do, excuse me, I'm going to, sorry, I worked last night. I'm going to check your sensation. So I'm going to use either a hard or soft object, and I'm going to touch anywhere on your body, and I want you to tell me where it is I'm touching and if it's soft or hard. Okay, close your eyes for me. Okay.
Soft forehead. Sharp forearm.
Left or right?
Right.
Okay.
Left thigh sharp. Soft right thigh. Neck. Soft. Soft right leg. Sharp left leg.
Okay, great. So the sensation in his nerves and everything, he can feel. There's no abnormalities noted. He's able to detect where I'm touching, whether I'm using a soft or hard object. Now what I'm going to do is check his DTRs. So what I'm going to do is using his arm here. As you can see there, they're right above his elbow, little soft spot. I'm going to hit it with my little hammer here, and I may get like a slight response here, a reflex. So let's see. All right, there. Now let's do this side. Okay, once again, in the soft spot, I'm gonna hit it. Okay, a little bit there. Okay, now what I'm gonna do is check the brachial So with the tricuspid, you're checking the C5, C6. The brachial, you're checking the C6. With the knee, you're checking the L4. And then we're going to do the Bushinski, which is going to check the sacral nerve root. So going back to the brachial, I'm going to place my thumb here, and I'm going to hit my thumb, and I should get a slight response. I'm going to tap my thumb in, okay, a little bit there, and I'm going to do this side, do the same thing here. Okay, all right, little response there. All right, now what I'm going to check are his knee response. So I'm going to just hit the knee, a little soft spot right here to see if I get a reflex here. So hit it. All right, just a little bit there. I'm going to hit this one. All right, a little bit there. Now I'm going to check the foot, the ankle. It's a little soft spot right between the ankle bone and the Achilles, and I'm going to hit there, and I should get a slight response. Okay, a little one there. Okay, I'm going to check that side, hit that. Okay, a little bit response there. Now I'm going to do the Babinski, where I go up the side of his foot and across under the toes, and I should get the ballerina point, not the flaring, which would not be a good response for his age. I believe up to the age of 2. The flaring of the toes is okay. Beyond after 2, the toes shouldn't flare. So we're gonna go up this side. Toes should point in, and they are. And I think I'm tickling him. So, all right, let's do this side. Okay, this is gonna be difficult. Okay, the toes, we did get a ballerina point. I'm not sure if you guys saw that. But we got the reaction that we wanted. So everything is bilaterally equal, no abnormalities noted. He's got good reflexes. So now what I'm going to do is check his eyes, ears, no, just his eyes and nose. I'm not going to do his ears because I don't have the tool for his ears. So checking the eyes, what I'm going to do is check the pupil response. So I'm going to use my light come in. The pupil should be reactive to the light. Okay, reactive on this side. Okay, and what I'm going to do is put my hand down the center of his face. And so when I come in with the light, whatever is happening, when I flash the light here, the pupil should respond the same way on this side. They should both be reactive. It shouldn't be abnormality with this one responds to the light and this one stay the same. So eyes open, nice and wide. Okay, and all right, great. Now checking this side. All right, great. All right, so his pupils they're round and reactive to the light bilaterally. Now what I'm going to do is check his balance as well. So I'm going to have you stand up here. Okay, so I'm gonna have you check your gait. I should have did that before I started with the eyes. But here, we're already there. So I'll check your gait. I forgot that. So I'm gonna have you walk towards me. Okay, then I'm gonna have you turn around and walk back. And no abnormalities noted. His gait is fine. No difficulty standing or anything like that. So I'm gonna have you sit back up here on the table. Okay, so his balance was good, gait was good, no swing. Okay, so now, then I would, after doing that, then I would check the pupil response, and then I'm going to also check his nose. There's no nasal flaring, so there's no distress noted where it seems like he's trying to get any air or anything like that. I'm going to look at the mucous membranes here, the mucosa, and they're pink and moist. There's good there. Now I'm gonna ask him to open his mouth and look, and everything is pink and moist. No abnormalities or anything noted there. So everything is moist, no deviation, no nasal flaring. His mouth is fine, it's pink and moist. There's no cyanosis, meaning there's no bluing around or at the lips. so circulation is good. Now looking at his neck, his jugular veins are not distended, so there's no problems there. And I'm looking at him breathing, and he's not using any accessory muscles breathing like this, so he's not having any difficulties breathing. Now I'm just gonna palpate his carotid. Okay, and it's nice and strong on this side. Okay, and it's nice and strong on that side. So they're strong on both sides. No thrills or anything noted there. Now what I'm going to do is using the bell of my stethoscope, I'm going to ask you to hold your breath as I listen to your carotid here. Okay, awesome. Okay, hold your breath. Okay, great. Now listening on this side. Okay, nice and strong on both sides. No abnormalities noted with that. Everything seems to be fine. Now, also when I looking at him and looking at his chest and his breathing, there's no barrel chest here. There's no pigeon chest or where the sternum is going in and he's having difficulty trying to breathe or get air in. He's not in a tripod, even though he's sitting with his arms here. He's not leaning forward in a tripod position. You're fine, sweetheart. In a tripod position where he's trying to get air. Oh, let me turn my light off here. Now what I'm going to do is I'm going to check for any vibrations in his breathing with his in his chest using my hand. So I'm going to check the 4 points here, and then it's 6 points on the back that we're going to check. And I'm checking for any vibrations in his chest. So everything is fine. Okay, no abnormalities here. And then if you turn a little, you can see where I'm checking here. 6 points. As he's breathing in and out, there's no abnormalities noted there. No wheezing, no crackles, no bronchi. His lung sounds are normal. It appears to be clear all throughout at the time. Now what I'm going to do is check his valves. So I'm going to start here with the tricuspid, and this is the clavicle. 2 intercostal spaces down. I'm going to listen here. Okay, nice and strong. Now I'm going to go for the pulmonic. Okay, that's nice and strong. Now 2 more points down, and I'm going to go to the Erb's point. Okay, now up under the nipple. Okay, I'm listening for the mitral, apical pulses are good. Okay, so those are nice and strong. No abnormalities, no galloping or anything. No murmurs noted. Now I'm going to use the bell, and I'm going to listen to the same areas. So I'm going to start here, listening. And then I'm going to move over. All right, go down to the Erb's point. Okay, there's our tricuspid. Alright, mitral right up under the nipple here. Okay, S1, S2, good. No galloping, no S4, 3 heard, no murmurs, nothing like that. The murmurs might have like a swooshy or type of sound. Then none of that was heard. So now I'm going to put this down. I'm going to check the capillary refills, and what I'm going to do is press on his finger nail beds, and just for pressing it down, the circulation color should come back in less than 2 seconds, which would be normal. If it's greater than 2 seconds, then that means it's sluggish, and it is not. Everything is great there. There's no sluggishness observed. Capillary refills are good bilaterally. Now I'm going to check for any edema, so I'm checking the upper extremities of his arm here, checking on the bony parts, the legs, the front of here, and his feet pushing, and there is absolutely no edema. I can't push anything in. The skin is firm. Um, there's no issue with any edema in any of his extremities. Now what I'm going to do is I'm going to check his pulses. So let's start with the bicep. And so I'm gonna push in here. Okay, nice and strong. Check this side. Okay, nice and strong. Now I'm gonna check here. Checking the pulses here. Okay, radial. They're good, nice and strong. Radial pulses. Okay, radial pulse, nice and strong. Now what I'm going to do, I could have him lay back and check the femoral pulses, which would be here and here, and I would palpate that, and I would be able to feel that. I'm not going to do that right now. But now I'm going to check behind the knee, the popliteal. I'm going to hold this out. You're fine, baby. Just like that. Okay, I'm going to check behind the knee. All right, that's good. Check this one. Okay, now I'm going to check the pulses, palpate down in the feet here, the DP and PT of his feet. Okay. All right, both sides. So everything, pulses are nice and strong. Pulses are nice and strong. Bilaterally all throughout. No abnormalities noted with his pulses there. Now what I'm going to do also is check his extremities for temperature to make sure there's no extreme coolness or warmth felt. So checking here with the back of my hand, that's what I'm using. Okay, and there's no abnormalities noted in his the warmth of his extremities, no excessive coolness or anything like that, meaning that there could be poor circulation, no warmth or anything down with his legs either. So they're not too cool, not too warm. He's just right. Now I'm going to do his abdomen. So what I'm going to do is have him lay flat on the table here. Lay back, sweetheart. I got you. All right. And what I'm looking for is any waves or rippling or anything like that. Looking at the bowels to see if there's any excessive bowel movement, not actual bowel movement, but the movement of the bowels in his abdomen. And they're flat. There's nothing going on there. And now what I'm going to do is I'm going to listen to his bowels in all four quadrants. So I'm going to listen up to 3 minutes. And I'm not going to actually do that because I will make the video too long, but I'll start here in the right quadrant and move in a clockwise position, going and checking each quadrant and checking to make sure that that his bowels are normal, that they're not hypoactive or hyperactive or absent, which meaning there's no sound heard at all. Now I'm going to check, so there's no abnormalities noted there. Now I'm going to listen to his arteries here. So I'm going to listen using the bell and the stethoscope. Okay. And I'm going to move down right above the um, belly button. Okay, great. Now I'm going to check the arteries that are connected to the kidneys. Okay, and I'm not hearing any abnormalities there. So there's no abnormal sounds heard. Oh, let me check the iliac as well. I'm sorry. So let me check the iliac arteries. Okay. Okay, so looking, so once again, to recap, there's no scars or abnormalities noted with the sound of his abdomen. So no scarring, bowel sounds are heard in all four quadrants. They're active. There isn't any ascites or rippling or anything noted here, or excessive bowel rippling, shall I say, as he's laying here flat on the table. So what I'm going to do now is palpate. I'm going to do it softly, using just the pads of my finger. I'm going to do it in a rolling motion, but really, really soft. And if the person were presented with issues in a certain area in the abdomen, of course, I would do that area last. But starting in the right, I'm just going to do all four quadrants. And what I'm checking for is to make sure there's no edema or ascites or anything, which would be a ripple effect seen in his abdomen. And it's not at all. And then now what I'm going to do is I'm going to check and do percussions, sorry. And using my fingers, I'm going to put my hand here and I'm going to use these fingers and I'm going to tap over each quadrant of his belly, starting here, which would be more of a solid sound because the liver is here. Okay, and it is. Now, it should be pretty hollow in other places. The stomach is sitting here. Okay, this side. And this side. Okay, hollow there. So, to recap, there's no distension noted in his abdomen, no abnormalities, no ascites, no pain noted. Patient did not present with any pain upon palpation of the abdomen. So he seems to be, I'm gonna help you up, baby. He seems to be, everything is okay. He seems to be in good health. And thank you.